Welcome to UK Health Matters, where we explore exciting news and initiatives at UK Healthcare. I'm your host, Madison Waldick. On this episode, we'll highlight our quickly expanding Kentucky Children's Hospital affiliate network. We'll also learn about a unique allergy that can develop after tick bites, and recap a wonderful annual event that honors patients who are thriving after traumatic accidents. Let's get started. Our Kentucky Children's Hospital affiliate network was created to ensure kids across the state have access to high-quality care no matter where they live. We partner with community hospitals throughout Kentucky to connect families to the expert pediatric care they need close to home. Network Director Christina Briggs recently joined Fox 56 to discuss the program's mission and the resources it provides to affiliate hospitals.
First off, tell us about the network.
Yeah, so we were super excited that we launched the Kentucky Children's Hospital Affiliate Network in January of this year. And so the purpose of it is to really bring advanced pediatric care to our local community so that they don't have to travel back and forth to Lexington to get the care that they need. So I know Dr. Scotty Day, our physician-in-chief of Kentucky Children's Hospital, has been here often.
Yes.
He has a vision that no matter where you're born in the state, you should have access to the same high-quality pediatric care that you would get if you were born in a large city. He's very passionate about it, having grown up in a small rural eastern Kentucky city. And so, we're trying to empower those local healthcare professionals with knowledge and education so that they can care for the kids in their own communities.
What specifically is that support that these smaller community hospitals will be getting?
So they get an opportunity to work closely and learn from our pediatric experts. So whether that is our pediatric physicians, our pediatric nurses, respiratory therapists, our child life team. I know Jennifer Williams has been here before. Getting access to learn from them. So we have virtual lecture series that they can tune into. And we'll actually work specifically with the hospital and say, okay, where are areas of opportunity for your teams in pediatrics? And we'll create a customized plan for our teams to travel to their hospital and do those trainings inside their facilities to help them with their pediatric care. They can come to Lexington and observe our experts in a clinical setting. We're going to host our first annual conference in September where we're going to have a day and a half of education and training. So there's a lot that's offered to members of the affiliate network.
Why is this network such a difference maker in the lives of Kentucky kids?
Well, I would say, we understand that it's better for the patient, it's better for the family if they can stay local to their support systems. And a large demographic of the patient population that we serve have financial hardships, and so traveling back and forth to Lexington can be a financial burden on top of already having a sick child. And so we're trying to alleviate that when possible for those kids to find that care in their local communities.
Most people know that tick bites can lead to Lyme disease, but they can also cause a rare allergy to red meat and other animal-based foods called AlphaGal Syndrome. Kentuckians are more at risk for AlphaGal Syndrome because the type of tick that carries the allergy is common here. Dr. Arfa Fez, an allergist with UK Healthcare, recently joined us to speak about the symptoms of AlphaGal Syndrome, how to avoid it, and what to do if you contract it.
If you enjoy the outdoors, you will find ticks often on your person. I have a lot of patients and friends who have, find ticks. Make sure you do a full body check. So if you have a friend or a partner, have them, do a full examination after you hike or have been in a wooded area where there are ticks. So AlphaGal syndrome refers to a condition where you're bit by a tick, specifically the Lone Star tick in the US, and your body produces antibodies to the AlphaGal that is contained in the saliva of the tick. The tick bites you, sensitizes you to the point that the next time certain genetically predisposed individuals eat products with AlphaGal, the antibodies in their system will think it's attacking their immune system and they'll attack that part of the product instead. So typically in red meat like beef, pork, lamb, and milk products. So AlphaGal allergy is similar to other allergies, what we think of like rashes, swelling, hives, problems breathing, vomiting, diarrhea, sometimes even passing out. and usually vomiting multiple times, typically waking up in the middle of the night with these symptoms. We found that this is a delayed type of allergy, so the symptoms occur about 3 to 8 hours after ingesting the implicated food. So most people, have dinner with steak or beef or pork, and then their symptoms start in the middle of the night. Typically, patients present after their primary care doctor has diagnosed or are considering this as a potential diagnosis. A few times, patients have really severe symptoms in the middle of the night, like I mentioned, repetitive vomiting or hives that are not going away, and so that's when they usually present to the emergency room with these symptoms. Treatment is avoidance of red meat products. That is all beef, pork, and lamb products for most people. For some people, milk products will also be included. Again, depends on what your symptoms were and what you ate. And that is for the foreseeable future. You typically do have to carry epinephrine with you.
Emergency medical situations, unfortunately, are part of all of our lives. UK's Albert B. Chandler Hospital is home to the only Level 1 trauma center dedicated to Central and Eastern Kentucky. That designation means we can handle the most complex emergencies with the best care possible. Every year, UK Healthcare invites former patients and their loved ones to attend a celebration of life on National Trauma Survivors Day. This event brings survivors together to share their stories. Highlight the friends, family, and providers who made their survival possible, and form a community rooted in their experiences during and after trauma. For many survivors, trauma doesn't end when they leave the hospital. The emotional, mental, and physical effects of trauma can be felt for a lifetime. This ceremony is a reminder of the power in people. Sometimes the best medicine is a hug from someone who understands what you're going through. Visit ukhealthcare.com/extraordinary people to meet some of our trauma survivors. Thank you for joining us for this episode of UK Health Matters. To learn more about how we're working to create a healthier Kentucky for everyone, visit ukhealthcare.com.